This is the 9th year of this New Horizons Echocardiography Conference. Some of the basics of measurements, as always, but some of the highlights that were novel involved valvular heart disease. And within valvular heart disease, some of the important components were the evolution of using percutaneous repair strategies for the aortic valve. There was some discussion regarding the E-clip, which in South Africa is in its early stages, but good to see. Other important components were using the novel echocardiographic technology, such as speckle track or strain imaging, and the added advantage of early detection of this new technology in assessing myocardial function, be it due to valvular heart disease or, as mentioned in one or two of the talks, due to chemotherapy. So to see that sort of cutting-edge discussions taking place, while it may not yet be in clinical practice within South Africa, it certainly creates an awareness, and hopefully in ensuing years the technology is adopted. Furthermore, I enjoyed the presentation on mitral valvular disease. The discussions around mitral valvular disease focused on the importance of identifying not just the structural abnormality, but the background as to who benefits from surgical repair versus surgical replacement, and the challenges associated with repair of the mitral valve. The incremental benefit of 3D transesophageal echocardiography was an excellent highlight for this presentation, and certainly garnered a lot of questions, as you will notice from the online presentations that will be available to those attending the conference and those who wish to subscribe to the conference. While there were many nuances, some of which I mentioned, another highlight was the mechanical dyssynchrony and the use of strain or speckle track in helping with resynchronization therapy. So this early discussion of electrophysiologic technology to help myocardial dysfunction or patients with LV dysfunction was also quite interesting, and I'm sure as the years go by forms a foundation for building on future conferences. This is an excellent educational opportunity. I understand from the conference organizers there are 220 plus attendees. Maybe half of them are sonographers. There's been hands-on workshop, which not very many centers used to teach. But most important, there were live demonstration transesophageal echocardiography at the Baragwanath Hospital, which is rather unique. I do not believe that there's any other country or any other conference that has the ability to do live, hands-on transesophageal echocardiography. Now, certainly for me that was a highlight. I was somewhat involved in that workshop, and the pathology that emanated, some of the cases I had maybe seen once before, and others I had not seen at all. The quality and the skill of the operators, of the faculty, have been tremendous. As you know, our faculty are drawn both from the United States, from prominent academic centers, as well as from Europe, from prominent academic centers. Dr. Nianopoulos in the UK is a well-renowned figure in the cardiology world with special expertise in echocardiography. Dr. Jerome Bax is a world-class leader, researcher, high publisher in multimodality imaging. And Dr. Bijoy Kandaria has been preeminent in the echo world for the last 3 decades. So these are just examples of the very many strong and talented leaders of the world in echocardiography that come and teach. I certainly enjoyed them, enjoyed their presentations, and I personally have learned a lot.